Thank you for joining us for another episode of the Wellness Doctor Network, where we connect the community to top-notch doctors. I'm Dr. Holland Meyer, along with my special guest, Dr. Jason Williams. Thanks for joining us today.
Thanks for having me, Dr. Meyer. Glad to be here.
You bet. Dr. Williams is a minimally invasive laser spine expert in the DFW area, but people come see him from all over the nation, so it's very much an honor to have you here today.
Thanks again.
You bet.
Glad to be here.
What kind of things do patients come see with? What are they struggling with?
Patients come to see me for, most usually, since I'm a minimally invasive spine surgeon, for back pain. That includes neck pain, mid-back pain, low back pain, pain that's going down their arms or the legs, or even numbness or weakness in their extremities as well.
Right, and so what are some of the diagnoses that they come in to see you with?
Patients come to see me with diagnoses like sciatica, degenerative disc disease, back pain, neck pain, pain or numbness or weakness in their arms or legs. Some patients even come see me after they've had surgery, like a fusion or a discectomy already. I'm still able to help those patients.
Awesome. So it sounds like a lot of the patients that come see you are basically referred from primary care physicians, physical therapists, chiropractors that have already undergone some conservative care.
Correct, yes. Most of the patients that come see me, I've already exhausted all those modalities.
It's required, actually. You had mentioned to me.
Yeah, absolutely. You know, I want patients to do the conservative therapies with their PTs, their chiropractors, their family practice doctors. And once those modalities have been exhausted, then that's where I come in.
So how is it that you're able to help these patients? What makes you so unique?
Well, I truly do the most minimally invasive spine surgery available. A lot of patients, I can do their surgeries through a needle, so they don't even require an incision. And if I do have to make an incision, it's not more than 2 to 3 millimeters in size, so they may not even have a scar after that.
That is incredible, and I think that's what really put the light bulb in my head about how it is minimally invasive.
Yeah, truly.
Sometimes no scar, tiny scar, and oftentimes no medications afterwards.
Correct. Some patients wake up completely pain-free and require no medications post-operatively for any post-operative pain.
That is life-changing and life-giving.
Yeah, true. They appreciate that.
Yeah, can you share a success story with us? I'm sure you have a ton.
I do have so many. I've been able to help patients that have already had surgery before. They've had a fusion or some kind of discectomy. Been able to help athletes that were unable to do their sports activities, like tennis players, skiers, and professionals as well, to get back to their sports activities. Been able to help the weekend warriors get back to their working out routine, and I've been able to help those patients that can't get back to work. I've been able to get them back to a healthy, productive life.
How awesome! I'm sure it feels so good playing a role in getting their life back.
Yeah, it's amazing. I love it.
So speaking of, what is one of your favorite things that you love about being a doctor? I never let you leave before I ask that question.
Great, no problem. I'm glad to answer that. I really love the looks and the joy in my patients' faces after they've had a successful minimally invasive spine surgery. They are truly grateful, and you can tell. I mean, a lot of them even hug me because they're so joyful.
Right, and from what time I've been here at this office, it's interesting and awesome to see how it's almost like your patients become family.
Yeah, we love that. We love that. And, I treat them like family, like I would my own mother.
That's awesome. And thanks so much for joining us today.
Thank you, Dr. Meyer. I appreciate everything.
You bet. Thank you. And thank you for joining us for another episode of the Wellness Doctor Network, where we connect the community to top-notch doctors. And even within the network, we collaborate so we can bridge the healthcare gap. Thanks for joining me. I'm Dr. Holland Meyer.